This is Frequently Asked Questions about Natural Migraine Relief, Episode 24, Gastrointestinal Health, Migraine, and the Role of H. pylori Infections. Hello, this is Jeff Baker, your physician host for FAQs about natural migraine relief. Sometimes the clinical presentation of a problem, like a migraine headache, can have a root cause in another seemingly unrelated part of the body. I find this not only to be common, but truly almost without exception. Today, we're going to discuss a version of this that involves the gastrointestinal tract. A common cause of acid reflux and stomach ulcers is a colonization or infection with Helicobacter pylori. This bacteria can also be present without causing significant GI symptoms. The presence of H. pylori in the GI tract can also be associated with vascular inflammation in other parts of the body. The potential interaction of this kind of vascular inflammation and migraine headaches has been the focus of several studies. One of these studies found H. pylori infection in 40% of headache patients, with the prevalence of migraine type headaches being significantly greater in the H. pylori infected patients. The study assessed whether the eradication of this bacteria was able to reduce the frequency, intensity, and duration of attacks of migraine headache. After H. pylori eradication, clinical attacks of headache completely disappeared in 17% of these patients. Moreover, the intensity, duration, and frequency of headache attacks were reduced 69% in the remaining subjects. In another study, 40% of those they looked at had H. pylori, and 83% of those who were treated became H. pylori free. From within this group, migraine patients who had their infection cleared had a significant reduction of intensity, duration, and frequency of attacks of migraine headaches. Then there's the review of the literature on H. pylori and migraine, which concluded that the clinical trials conducted in this field strongly emphasize the benefits of eradicating H. pylori infection in migraine patients and have estimated its effectiveness in improving migraine headaches was equivalent to current common migraine treatments. And then there's the issue of white matter lesions, otherwise known as WMLs, as seen on CT scans of the brain. These represent cumulative damage from hypoxia and ischemia from blood vessel disease and damage. It has been repetitively shown that WMLs are more common in migraine patients than in the typical population, and also that H. pylori is a risk factor for having these white matter lesions in chronic migraine patients. The evidence strongly suggests that having H. pylori infection, whether it's symptomatic or not, can propagate vascular changes that may affect not only migraine pain, intensity, duration, but also long-term brain complications from H. pylori. So here are some action considerations for those with migraine. Number one, if you've been diagnosed with gastritis, gastric or esophageal reflux, or ulcers, you should be checked for H. pylori. Number two, if you're on long-term acid blockers, ask your doctor if you should be checked for H. pylori, even if you're currently symptom-free. This is a simple blood test. You need a sufficiently acidic pH to kill this bacteria, and an acid blocker could hold down some GI symptoms while still allowing the vascular inflammation effects from the ongoing presence of H. pylori bacteria. Number three, there are some herbal therapies aimed at H. pylori, but the standard 2-week antibiotic plus acid blocker therapy regimen still appears to be the most effective therapy for H. pylori bacterial eradication. And number four, keep in mind that in virtually every case, having a migraine is a combination of underlying and contributory root cause factors. When you identify and address as many of these as possible, you can not only reduce headaches, but also manage other seemingly unrelated health issues that could have a long-term impact on your health. Learn more about your migraine root cause factors and specific non-drug interventions. Managing pro-inflammatory conditions as a factor in migraines is only one of over 90 potential non-drug interventions we discuss in the online course, Natural Migraine Relief for Women. If you're not already a course subscriber, you can learn more about your migraine root cause factors by looking to naturalmigrainerelief.online for more information on how you can find and personally triage the best non-drug therapies to relieve your migraine headaches. Also, remember to subscribe to this YouTube channel and also my Substack blog to get regular postings on frequently asked questions about natural migraine relief for women. In conclusion, here are the references we discussed during this presentation.